All right, we're going to go ahead and get started. I'm sure people will trickle on as we go in. If you'd like to go ahead and start by inputting your name and organization and contact information into the chat, we are going to regularly share these after sessions like this going forward with the Florida Naloxone Network. The spirit of this network is for us to collaborate and communicate, and the best way is to add to our address books. Thank you, guys. So I'm excited to welcome you guys to Project Opioid Florida's newest program, the Florida Naloxone Network. I'd like to take a moment and thank our sponsors, Aetna CVS, for helping us get this program off the ground. It's really great to see organizations like theirs aiding in these efforts that we have in our state. My name is Amber, and again, I'm with Project Opioid Florida. I'm the Director of Program Development and Harm Reduction Outreach. And I'm excited to talk to you about expanding advocacy and naloxone distribution across the state of Florida. My email is right here on the screen, but a member from my team will also be inputting it into the chat during throughout our talk today. So please, hopefully you can get a chance to grab that information. Just to go quickly over our agenda for today, I'm going to start by introducing you to Project Opioid if you're not familiar with who we are, and to our speakers that we have on the call today. But then we're going to kind of do a little bit of a landscape review over the crisis in Florida. If you've been on any of our previous webinars for Project Opioid, you've seen we've been talking heavily about the preliminary 2022 data that has come out. And we are eager to get that data out as quickly as possible to members of the community because it shows some really, really important points, and I'll go over those there. Then I will talk to you exactly about why you are here today, what the Florida Naloxone Network is, our program priorities and functions, our goals for year one of this network, and then to again act in the spirit of what this network aims to do, and that is to educate. We bring in on a guest speaker to bring a little bit of awareness about a new form of naloxone that is coming to market in the state of Florida and through the SOAR grants program, overdose prevention program in the state. And then we'll talk about some next steps and some closing remarks, and I'll get you guys out of here, okay? For anyone that's just joining us now, please take a moment and put your contact information in the chat. The spirit of this network is for us to collaborate, and I want to ensure that we do so by increasing our address books and being able to reach each other. If you have any questions, please try to keep them out of the chat and put them directly into the Q&A. That way, someone from my team can ensure that myself or other speakers get access to that question quickly and are able to answer it, and it doesn't get lost in the chat while everybody's putting in their introductions. Thank you very much. So first, I want to tell you about who we are as an organization. Project Opioid exists solely to be the street sweepers on this issue. We are here to clean the path and ensure that all roads to recovery are as optimal as they can be. This means we are advocating for legislation. We are talking with leaders across every sector in our community and encouraging collaboration so that the recovery and treatment communities and harm reduction organizations across the state can be most effective. We want to clear the obstacles and create a road to recovery that is accessible and equitable for all. And really, if you work on this issue, you understand that opioids don't care about the color of your skin, the money in your bank account, the religion that you are devoted to. It is going to unilaterally impact all of us. And so everyone has a stake in this crisis, and that's why we are here to bring them to the table. Just a little graphic here about how we try to bring everyone to the table yet again, to target our most at-risk populations. And as the data that's coming up in the slides to come will show you, those most at-risk populations are in our rural communities and are in our schools. They are our young people and our more quaint neighborhoods that don't have that same access to care that our metropolitan areas do. One more time, remember, if you're just now chiming in, if you do have any questions, please put them in the Q&A section. If in the chat, please input your contact information. We want to ensure everybody can connect with one another throughout the course of this network. So to go into our first topic of the day, I want to do a review of the landscape of the crisis in Florida. If you've been on our previous webinars, we did go over this in a little bit more detail, but I would just like to go over the key points. To do this, I brought someone on from our team to help digest some of these data graphics that we have on with us. So please welcome Steve Wilson from our team. Happy to be our data guy. So to go over these first couple of points, I'd like to highlight that overdose deaths in the United States continue to reach record levels, even in 2022 and most likely in 2023. Latest data from the CDC is showing that more than 110,000 people have died. In some communities, depending on how they track these numbers, that can be as high as 112,000 people across the nation. That's a lot of lives lost, and that equates to roughly 300 people or more a day. Imagine if every single day a full airplane crashed. Don't you think the airline community would have to respond to this issue? 300 people a day across the nation are dying from opioids, and that is a problem that we can solve working together. In Florida, we've seen a lot of encouraging numbers in this past year, which is insane. If you're like me and you've been working on this issue for a number of years, you have to year over year work hard and often are not able to see a return on that work because the deaths are still rising. However, in some communities, they've seen as low as 30 or 40% reductions in overdose deaths. In others, they're seeing likewise, but rise in deaths. In my home county of Seminole County, we saw an 11% reduction, and I can be pretty sure as to what has contributed to that. Harm reduction and MAT. So to go a little bit into detail about these numbers, Steve, could you help us understand what this graphic articulates?
Sure. So just visually, right off the bat, you'll notice that there are some blue counties and red counties. Nothing related to politics there. Actually, this is kind of more orange than red in this graphic. But the basic idea is that the counties that are colored in blue are those that have seen a decrease in their overdose death rates over the past year. Those in red or orange are areas where the death rates are continuing to rise. Amber mentioned Seminole County, for example, in the past year saw about an 11% reduction. Orange County, its neighboring county, saw a similar decrease. You'll notice to the right of those two counties on the coast, the darkest blue is Brevard County, which actually amazingly saw a 49% reduction in overdose deaths between 2021 and 2022.
That's tremendous.
Yes.
If there's anyone from Brevard on the county, congratulations. Your hard work is paying off.
I think even nationally, looking at all counties, Brevard was in the top 3 for seeing the most improvement in the past year. So that's amazing and really a testament to, they must be doing something right over there.
Yeah, for sure.
And just quickly, you mentioned that nationally, we are still at kind of a record level of overdose deaths. I think year to date, the figures are showing that nationwide, we're on track for about a 2.5% year over year increase in overdose deaths again. So we're looking at another year of record numbers nationwide. But in Florida, encouragingly, the downward trend has continued. And the latest CDC figures through May of this year show about a greater than 5% reduction in overdose deaths year over year. So yes, tremendous results.
It must feel really great for all of us to know that this work is starting to pay off, and we're really starting to see the impact that the advocacy and services we're able to provide across the state are coming into fruition, and they are saving lives. Really quick, before we move on to the next slide, could you just articulate what it means for these areas that are not colored in any way and are just gray parts of the map?
Sure. So the most common issue there is that you'll look in the Big Bend area of Florida. A lot of those counties have, their smaller population centers. So the figures that are reported, the CDC as a practice suppresses the data for smaller communities where the reported deaths are just, I think the current threshold they use is under 10. So that is the primary issue there. There are also some lags in reporting because all of these figures have to kind of flow upward from the local medical examiner's offices and sometimes through state bureaucracies and then on to the CDC. And there's various levels of analysis and layers built into the process. So there can be a lag in reporting some of the final numbers.
Yes.
So that's
and
mostly what's going on.
Thank you, Steve. For the fellow advocates on this call, you understand that bureaucracy is the death of data. It takes a long time to get this information out there. And while the deaths might be a low threshold for the CDC, they're not a low threshold for those communities, and they do have value. And so it's important for us to address them, even if they're deemed statistically irrelevant, right? Or insufficient. And so they aren't insufficient to us because each one of those deaths is a person, is a life that we value and we shouldn't have had to have lost. So thank you for helping us to understand that a little bit more.
Sure. Just really quickly, there was a question in the Q&A about the source of this information, whether this was medical examiner data or not. And these figures actually come from the CDC, but ultimately the source through those several layers of bureaucracy is the medical examiner at the local level. So yes, that is the ultimate source of the data.
Awesome. Thank you, Steve, and thank you for addressing that question. Moving on to some of the other key points that we found in our report, it's really just highlighting how prescription opioids are contributing less and less to the crisis than before, which means our society's initial efforts to attack this issue by attacking pill mills and curbing prescription opioids altogether has really done a great job about reducing prescription opioids' impact on this issue. But as most of you know, that is not what is causing the rise that we are seeing in overdose deaths. We have prescription opioids under control, which is amazing. However, illicit fentanyl has found its way into our drug supply and is either being laced or contaminated into all drugs. And so now we have a population becoming addicted and overdosing that probably never intended to take opioids in the first place. And this is a huge problem because now the worst dare nightmares of our dream, right, of our lives are coming true, and all drugs are becoming more dangerous. And it's such an important point for us to be making, because we can educate those who are actively using opioids as best as we can. But if those who are just trying different drugs, taking ecstasy, cocaine, or amphetamines, they are now being exposed to a deadly drug and they don't even see it coming. So it's really important for us to understand that the crisis is shifting. It is not prescription opioids anymore. It is illicit fentanyl, and it is pervasing into all of our drugs. It is this major driver behind this crisis, and it's roughly causing the death of around 70% of our overdose deaths. It's the leading contributing substance. That's not to say that other substances are not also involved, but when you are overdosing from fentanyl, your central nervous system is shutting down and you can no longer breathe, and that is critical to your life. Really quick to just show here, Steve, could you just help us understand this graphic and how it shows the rise in fentanyl overdose deaths?
Sure. Well, so as you mentioned, in an earlier phase of the overdose crisis of recent decades, the primary driver was those prescription opioids. And then as there was a crackdown in that area, things kind of shifted to heroin for a time. But starting really about 2015, 2016, fentanyl found its way into a lot of the drug supply. And then in the pandemic, the fentanyl deaths just really skyrocketed. And this chart shows that, a decade ago, there were fewer than 10,000 deaths attributable to fentanyl in the United States. And now there are, if current trends continue, we'll be approaching 100,000 fentanyl deaths a year. And as you mentioned, fentanyl is now responsible, playing a key role in about 70 to 75% of overdose deaths. And among overdoses due to opioids, it's greater than 90% at present. So the driver of this crisis at present really is fentanyl. And it, as you mentioned, it's found its way into pretty much the entirety of the drug supply. So you mentioned how a lot of the youth that aren't really intending to take opioids are being exposed to fentanyl. And the deaths among the youth are really skyrocketing at a rate that far surpasses that of the general population.
Thank you, Steve. That actually leads to that next key point. Yeah.
And this is actually despite no real increase in drug-seeking behavior among the youth. Survey after survey, study after study shows that really drug-seeking behavior has been constant for decades. But with this massive upswing in deaths among the youth, really what is to blame is the fentanyl.
Yeah. And to articulate that massive upswing that Steve is referencing, we have seen fatal overdoses among adolescents aged 14 to 18 jump by an alarming 94% in 2020 alone, versus the 29% for the overall population that we've seen the rise in, and a further 20% in 2021 versus the 11.5% for the overall population. So the people who are dying at the highest rates now are our young people. They have not had the chance to really become dependent upon opioids. And that is where this term opioid naive is so important for us to understand, right? And we can talk all day about the nuances between drug-seeking behavior and those who are actively using, those who choose to use opioids versus benzos versus amphetamines. But the problem remains the same. With fentanyl finding its way into the drug supply, your kid who ran out of his Adderall prescription and goes to his friend to buy it doesn't know that his friend got it off of his drug dealer. That kid didn't know that that wasn't a prescription Adderall at all, and it's really just meth pressed with fentanyl. This has happened. This has happened, and we are seeing it happen every day in our communities. These kids are being poisoned by fentanyl. So it's important to note here that medications such as naloxone and buprenorphine are proven tools to address this issue. And as we can see by the differences in the data from county to county and state to state, those who are embracing these tools are seeing reductions in overdose deaths. And I think in the years to come, we're going to see reductions in individuals entering recovery. We're going to see, in the long run, I think, and hopefully a reduction in overdose deaths across the board. And hopefully we can find a world one day where there are less people addicted to these drugs. If anyone is asking in the Q&A, why is fentanyl being put into everything? We got to take a moment and be honest with ourselves. Fentanyl is the high fructose corn syrup of the drug industry, everybody. It is cheap to manufacture and it is addictive as hell. So what does a business want to do when it wants to create a customer for life? It doesn't take that long to think about it. Even our illegal drug manufacturers and drug dealers are business people. Some of them probably have legitimate business degrees. And so it's important to understand that the same things that drive our economy are driving the drug economy, the illicit drug economy. And that is why. That is why fentanyl is in our drug supply, because they can, because it's cheap, and because it creates a customer for life, and it gets you high as hell. There's really no other way to put it. So, Steve, we talked about the rise in overdose deaths amongst our youth, but I think it's important to see this visualization, to see this rise, to see this huge jump in deaths among young people. That is a generation of Gen Z and Gen Alpha. Some of us on this call might be Gen Z, or we might have our own Gen Z or Gen Alpha kids at home. I know I do. And so it's terrifying to see these rise in numbers. It's not the same as when we were in school.
And I think this chart really just lays it bare. I mean, that jump between 2019 and 2020, I think everyone remembers what happened in that period. In the pandemic, the lockdown, all of the mental health issues that have arisen. They're not really going away. And we see that in the sustained level of deaths, definitely nationally. In Florida, we've made some progress. But even so, we are sitting at this new, very much higher plateau. And the youth are affected more than anyone by this. So that's really where we must focus a lot of our efforts.
Yeah. Thank you, Steve. I appreciate you for hopping on from behind the desk to help me talk about this data. I really just wanted to use this data to articulate the importance behind the goals of the Florida Naloxone Network. We need to continue the education. We need to continue the infusion of naloxone in our communities. And as far as priorities go, we need to target our rural communities that don't have access to as many of these resources, and to those that are overlapping with being what we refer to in this field as naloxone deserts, right? We need to get them fully satiated with naloxone, with education and best practices. And then we need to set our sights on schools. We need to focus on K through 12 and universities, educating our youth and empowering a generation to hopefully choose not to use, but if they do, to do so more aware of what they're putting in their bodies, right? And safer for it, because we want to avoid death here. And that is the critical thing at risk, is their lives. One of the ways that we do that in this organization is we try to come up with simple ways to help educate people on the tools that exist and that are available. One of those ways is through the creation of what we are calling the Community Overdose Response Matrix. This is a very simple graph to kind of help people at a high level understand how to respond to an overdose, specifically when it comes to naloxone. Now, some of you know, or most of you know, that Narcan is the go-to for reversing overdoses. But because of the way the crisis is shifting and fentanyl is driving this issue, there are newer versions of naloxone, both high dose and low dose, that are coming to market and that are coming to be available in the next few months through the overdose prevention program run by DCF, powered by the SOAR grant. And so it's really important that we educate one another on these different tools that are available, because all tools should be used on this issue. And we should all be empowered to understand how to use them differently from one another. There is no this one thing, that one thing to solve this issue. There are billions of people on this earth. We have millions of responses to different issues and different things. Whatever that might be, apply it to whatever topic you want. There are multiple ways to attack these problems, and it's important to understand how we can do that. It might not be able to be simplified down to a binary choices. but that's okay because we're all capable of learning and understanding and growing. And so we developed this chart, which we worked alongside some very amazing MAT providers and emergency medicine doctors, specifically Dr. Todd Husty, who works and runs the Hope and Healing Center alongside some other wonderful physicians that really helps to save people here in Seminole County coming out of the jail systems, providing them with MAT in the jail and then bridging them into the Hope and Healing Center after they get out of jail so that they can get that continued treatment. And they are seeing amazing success. They have had to increase their hours, add more physicians. They've expanded to be able to include women. Hoorah. And they are seeing tremendous success, and it is so heartwarming to see, and it's like motivating in this work, because again, so often we've had to motivate ourselves without being able to see that return. With having to see those deaths increase every year, it's very hard to continue to do this work and not see that. So it is just amazing to be here at such a pivotal time while we're starting to see those successes coming to fruition. So to just quickly go over this matrix, it's really just talking about how someone would use naloxone depending on their environment and the person who's receiving it, right? So we kind of put this up to the top. Medical facilities, they have the tools and the equipment and the training to be able to titrate intravenously or intramuscularly opioids. And so they are able to determine very easily between opioid dependent, opioid naive individuals. They're able to provide that air to keep the individual alive and provide very small doses of naloxone necessary to wean people out of an overdose. And that is what they're trained to be able to do. And it's great that they can do that. As we move into correctional facilities and law enforcement, we start to lose that high level training. We have correctional officers having to respond to overdoses. They do have medical facilities, but you can see how they kind of have two worlds there. They have medical professionals who at a point can address this, but prior to that, the first responders in a jail situation is going to be those correctional officers. So they're going to need to be empowered with intranasal Narcan or Cloxato or some other option as well, and then be able to then have that very easy connection to the medical facilities within the jails or prisons. And then those medical professionals can provide that type of titration or mitigated care. With law enforcement coming to the scene of a lot of our overdose issues across the state, these individuals are not medical professionals, and we shouldn't be asking them to be either. But what we should be doing is empowering them with the most powerful and efficient tool that they can offer in that moment. And so it's of Project Opioid's opinion that should be an 8 milligram version of naloxone. And there's a few reasons for that. The CDC has said that the average number of doses of 4 milligram naloxone needed to revive an overdose is roughly 3.7. Now, those numbers are a little outdated from 2017. However, it still goes to show you that it takes, in an emergent situation, nearly 4 doses of intranasal naloxone to be able to revive someone of an overdose. That is critical, because what that means is in most cases, a minimum of 8 milligrams and likely 16 milligrams of naloxone are going to be administered to a person regardless of the brand that is chosen. Now, police officers have to carry a lot of materials on them. And so because of this, they're only able to carry, in most cases, 1 dose on them per officer, which means in order to get that second dose or that third dose or that fourth dose, they often need to have multiple officers come to the scene, unless these officers are choosing to keep additional naloxone personally, right? And so we want efficiency of care in this case, and we want to preserve life. It only takes 4 minutes without oxygen to start to have irreparable brain damage and have increased likelihood of death. 4 minutes. Efficiency is key. And then medical professionals can provide the appropriate care after that fact, as long as EMTs are still called. Now, we want to empower organizations and communities to choose as they see fit, and this is really just a tool to help that. Narcan has been the only thing available for so long that now that there's these new versions like Cloxado or Zimhi or others, there's a lot of confusion. What, why, how, where? As we move into schools and into the general public, we're talking about young people who are likely not currently addicted to opioids specifically. They might be on that road, or they might just be experimenting. And so again, the key here is to preserve life as quickly as possible. We do recommend Cloxado in this case because, as some schools have already embraced Naloxone, they can only keep so much. Again, these regulations are important to address when we're talking about institutions like law enforcement, correctional facilities, and schools, and even some businesses. But when you get into the area of private businesses and harm reduction, this is where we get to say, who cares about keeping it in your car? It's better to have it than not have it. We get to say, who cares if it's expired? It's better to have it than not have it. It's not as easy for institutions to be able to say those things. We as advocates will continue to do just that because we know it is better to have it than to not. But it's important to be able to articulate to these other groups, as we hope to have them embrace these tools, how and when it's appropriate to use different versions, right? And then when we're looking at harm reduction specifically, where we are engaging with individuals who might very well still be actively using, we understand that they're not going to want a high dose option. They're going to want something that is a little bit more of a low dose, that they don't have to worry about potentially going into precipitated withdrawal, but they don't want to die. Right? Dying is not the goal of addiction. And so it's really just important that we embrace all options that are coming to the table, and for organizations to know that in this new year, the overdose prevention program run by DCF and powered by SOAR is going to offer these options to us. We're going to be able to request not just Narcan, but Cloxado and other low dose or high dose options that are coming to the market. Really excited to see that coming to fruition. And really excited to continue partnering with DCF on their overdose prevention program, because I mean, the work is really saving lives. So for all the data that was going on, real quick, if you guys want to be able to access this data, please scan this QR code, and you can download everything from this overdose matrix to a copy of our most recent reports, key findings, and community recommendations. If those recommendations weren't made clear, we recommend naloxone, we recommend MAT. So now that I've gone over the why we are here, it's now to talk about what is even the Florida Naloxone Network. There's so many different groups and organizations that exist out there, and we're all doing really amazing work. I can't stress this enough. Harm reduction organizations, treatment providers, and recovery community organizations are doing tremendous work. But it's time for us to really start working together, collaborating, so that we can be most effective, sharing information, sharing strategies that are working for us or strategies that aren't working for us. We shouldn't be working in silos. We are a community, big or small. So the problem that was identified here is that people in crisis have a diminished ability to problem solve. There are many different resources that are available and even more places to search for them. But if you've ever been a person in crisis, whether that is mental health, trauma related, substance use related, it is incredibly hard when you are seeking help to navigate everything. Okay. A lot of times you end up in these spirals of calling this number that leads you to this number, that leads you to this website, that leads you to this form, which leads you back to that number. And these circles become endless, and they add on to the trauma, they add on to the stress, and they make you feel even more isolated. And so I call this paralysis. It's like decision paralysis or self-help paralysis. It's endless searching and it's overwhelming. And so that is what we need to address with this network. How are we going to try to do this? Well, hopefully within the Florida Naloxone Network, in our phase one, if you will, We are going to get the community to truly come together. Collaboration at all levels, from local government to federal government, all the way down to organization to organization. The key is for us to work together. We want to create equity for all paths to recovery. We know that there's a lot of inpatient treatment facilities that are available, but there's a huge barrier for individuals who are currently houseless or who do not have the income to be able to support paying for those programs. So we need to be able to support and empower those that can provide outpatient treatment, or those that can provide forms of medication assisted treatment that don't require long stints in facilities or daily, weekly trips to facilities, because that is it is incredibly hard for individuals to get themselves back to a place of independence and a place of productivity in our society when they're constantly being disrupted by doctor's appointments, and by clinic visits, and being buried under medical care costs. And so we need to be able to find equity for all paths to recovery. And we need to focus on keeping each other accountable, right? So often we say, well, I can't do this, it's not our policy, or this is what the numbers say, and this is what our grant requires us to report on, so these are the only things we can report on. I understand it. I live it in this industry as well. It is hard to not lose sight of the plot. But it is so important for us to keep each other accountable, not as a means of putting one another down, but as a means of lifting each other up to be our most successful, because the whole point is to save lives. The whole point is to protect life. So phase 2 of this is really going to be us working to find ways to meet people in need where they are. There's organizations that are already really doing the great groundwork that are out there on the streets. One example in my home community in Orange County is Transformation Village and United Global Outreach. They have folks on the ground every day distributing naloxone, helping to pull people into their new medication assisted treatment facility in Bithlo, and really making a huge effort in that very rural and hard hit community by the crisis. We want to create a niched community. If any of you here are on social media, you know that it has a lot of power for good, but it can also be a sea of information, both good and bad. So we want to try to create a niched community in some form so that it can move away all that mess and people can go there specifically for the purpose of seeking help or seeking resources. What this looks like, we don't know, but I hope to be able to partner with one of you guys in the next year to come up with that solution together. We want to remove the distractions and, again, create one bridge to all paths of recovery. So to go into our program priorities and functions, we want to simplify this process and guide people to care. We intend to do this through education, recruitment, and distribution, right? We want to saturate communities with best practices. We're not saying that we have all of those best practices, though we know that there are a few that are at the top of the charts, but we want to seek the best practices that organizations like yourselves are finding your best success in. We want to be able to embrace those just the same way that you do. We want to be able to share the ways that we might be finding success with your organizations as well, because we work better together, right? We want to recruit. And what we mean by that is we want more organizations offering resources like naloxone, or expanding their services to be able to provide MAT, right? We hope to empower 100 groups in our first year. It's a lofty goal, but we really want to increase the involvement in DCF's overdose prevention program, powered by SOAR. They do such an amazing job, and we just want to pile on all the people, not to give them more work to do, but because we know that the distribution of naloxone truly saves lives. And again, distribute, if that wasn't obvious. We want to make sure that all 67 counties in Florida are receiving naloxone. We don't want to see the word naloxone desert in this state. We are far too tropical for that. In order to do this and facilitate this goal in year 1, we are going to be looking at doing monthly calls for network members to be able to share news and resources. These are going to be simple phone calls, conference calls together. We won't we'll try and keep them brief, roughly 30 minutes, just to catch up on any big news that might be going on. I want to also be able to facilitate monthly educational webinars so that we can continue to share. I'd like to be able to lift the voices of organizations around the state so you guys don't just have to hear me talk all the time. So maybe one month I will perform a training, the next month we'll want to highlight another organization around the state, so on and so forth. And we want to change things up to be providing education on the new types of drugs that are hitting the streets, maybe new testing kits that are available, new programs that organizations are putting out, whether those programs are state, regional, or localized. I want to be able to lift all those voices up so that the largest audiences can hear them. And again, we want to make sure that we're on top of sharing best practices, latest news and legislation coming out. I hope to be able to build an online cache of resources that, again, aren't just coming from us, but coming from you guys so that we can all share them together. I think so often in the nonprofit world and in this industry, we have a tendency to run the same way our regular economy runs, like a competitive market, like we're competing against each other. We're not. We're working together. And now it's time to put our foot to the pedal and really lean in on that, because collaboration is key to saving lives. We are not competing against one another. So this is just a little shameless image to show you guys, some of the trainings that are going to be able to come out there. This is an overdose training that I provide to private businesses and organizations that invite us. And it really kind of takes the "Are you smarter than a fifth grader" approach by really lowering the threshold for individuals to learn about this crisis, starting with the very simple definitions of these things that we speak all the time. Other individuals just generally don't know. They don't speak our language, and so we need to meet them where they're at on that front. We need to distribute. We want to provide initial supplies of naloxone to organizations that are considering to join the overdose prevention program funded by SOAR. We want to empower those who are already part of that prevention program to be able to increase their distribution, maybe partner with organizations to do continued events or different events. And we want to empower business, faith, and philanthropic sectors to distribute naloxone and embrace harm reduction strategies in the workplace. Anyone who is in recovery knows you had to work really hard to build yourself back up from scratch. And because of that, I think that it's important to note that you bring a lot of value, especially in the workplace. You learned a lot of lessons, a lot of times the hard way. And for those of us that have not suffered with addiction and substance use issues, we may not fully understand the gravity of the impact that those lessons have on who you are as a person when you are on the other side in recovery. Let's see here again, just constantly reiterating myself, but we want to just continue that outreach. We want to get 100 groups involved in the overdose prevention program, so that DCF is just never done working. We want to help them be the best that they can. And myself and other organizations around the state are constantly on calls with DCF, helping them to improve their options, helping them to reach their goals. And so it's, again, we're all working together on this issue, and we need to continue to do that. And again, the primary focus for year one of the Florida Naloxone Network is rural communities and K-12 and universities. We have a 94% rise in overdose deaths among our youth. That is a huge problem, and we need to address it. And we have naloxone deserts in our state, and many of those are in our rural communities, and we need to address those now. I'll skip over this one. I've already drilled that one into you guys. If you are interested in really becoming part of this network, you can go ahead and scan this QR code or share it with someone who else you work with, or an organization who may not be on this call today. Please consider joining. We want to work with you. We want to work together, and we want to help you guys to save lives. So if you scan this QR code, it will directly sign you up for the Florida Naloxone Network, so that I will know explicitly you want to be a part of the founding members. And And then I will be reaching out with a follow-up to everyone who's on this call to give them that opportunity as well. Just being on this call today is not your submission to join the network. This is just an information session for anyone to join. If you do want to be a part of this network, please scan this QR code or click on the link that is in the chat and join through that Google form that is coming out to you. Okay. Next, I want to talk about awareness, and in spirit again of this network educating individuals, I wanted to introduce you guys to Cloxado. So for that, thank you, Lindsay, for being on so patiently waiting for me. During Lindsay's presentation, if you have any questions, just one extra reminder, put your questions in the Q&A and we'll make sure someone from our team gets them to Lindsay so that she can answer them if she's able to. Lindsay, are you there?
I am here. Thanks so much for having me.
No, thank you for coming on. On my most recent webinar, my boss was talking about Cloxado, and we had a lot of questions come on about what's this? What is Cloxado? People had not yet heard of it, which is understandable given that Narcan is a household name when it comes to thinking of naloxone. So I thought it super fit for this call to, again, in spirit of the network, provide a little bit of education on Cloxado, which is an 8 milligram naloxone nasal spray. Lindsay, your information is here, but we will also put it in the chat. Tell me a little bit about yourself.
Yeah, well, hello, everyone. My name's Lindsay Bettis. I am the community health manager for the state of Florida, so I'm really excited to be working hand in hand with Project Opioid. A little bit of background about me. I grew up in a family with substance abuse. My father was addicted to drugs for many, many years. He struggled with alcohol use, and it's something that really plagued my family. So I'm thankful that I get to be able to help save lives in this area of work that I do, since it was something that impacted my family really greatly. And I'm thankful that he is in recovery today. And I'm very thankful to be able to say that, because I know that that's not everyone's same outcome to that story. So I feel very blessed to be in this situation. So thank you again, Amber, for having me on today. It means a lot.
Yes.
Like
Thank
she
you, Lindsay.
mentioned on the last call we were on, Cloxado was mentioned, and there were some questions in the chat about what it was. And a little bit of background. So Hikma is the manufacturer of Cloxado, which is the 8 milligram naloxone. For those of you not familiar with Hikma, fair enough, because they are primarily a generics company. So Cloxado was only their second branded drug. And they are a very philanthropic company as a whole. And they've donated almost 100,000 doses of Cloxado around the country for people to use as it has become, it's becoming more widespread around the country. So a little bit of background about Cloxado in general is that it was approved by the FDA in April of 2021, and we began distributing it in August of 2021. And it was developed because of calls from the CDC, the NIH, and the American Medical Association for a higher dose of naloxone to be able to combat the fentanyl crisis that we were seeing being infiltrated into our drug supply. So that's the reason that it was created. I have it with me right here, a little training device. So of course my blur is messing it up, but it is in the same nasal spray device that you would see the other lower dose option, the 4 milligram in. So if you are trained on how to administer Narcan, you also are trained on the same device on how to administer Cloxado. And just to address some of the comments in the chat today, we are never here to replace any other form of naloxone. We are here just to be another tool in the toolbox. Like she was saying, that one of the main focuses this year for the Florida Naloxone Network will be on schools and rural communities. And that is a place where Cloxado could be a great option, as well as other forms of naloxone. So we do want to make that clear that we are not here to say use Cloxado. We're here to say that this is another option, and we just wanted to make you all aware of it, as it is hopefully soon going to become available to the providers on the opioid prevention program through DCF. So we want to thank you all. It's being used in 38 states so far. And any clinical questions that you all have, please feel free to reach out to me. We can put up that bio slide again. But I just wanted to give you all a quick little update on that. And I see some questions coming in. And if you have any questions, I see that there's some questions about precipitated withdrawal. I'd love to connect you with our medical advisor. Her name is Dr. McPhail, and she would be able to connect and meet with any of the providers, the groups on here that distribute naloxone, and be able to give you a brief medical presentation or just be on there for a question and answer. All right.
Awesome, Lindsay, thank you. And yes, we'll make sure that her contact information is in the chat so that you are able to reach out to her with some of those more specific questions. To actually address some of those questions, I would like to say, so precipitated withdrawal is going to happen in like 90 something percent of individuals who are being reversed from an overdose. Because when you're overdosing from opioids, your central nervous system is shut down and you are not breathing. The key is to get air into there as quickly as possible. Those who are most likely to be administering naloxone in that emergent situation are not medical professionals, right? They are your friends, colleagues, police officers, those first on the scene, right? They are going to be the ones administering that. Because of that, there's no guarantee that dose for dose in that emergent situation, if you've ever been in it, you give the one dose, whether it's Narcan or Kloxxado, you give one dose, you're supposed to wait 2 to 3 minutes. But 2 to 3 minutes in an emergent situation is like an hour of time. If you've ever been in a critical situation like that, you know that time stretches. And so our ability to perceive those differences in time are hindered, which means we are likely often to give extra doses regardless of the need, right? Because of that simple fact, which again is because we are not asking people to be medical professionals. That is why you call 911. That is why you get them to the hospital every time, right? So medical professionals can provide that work. Precipitated withdrawal is going to happen to anyone who is dependent upon an opioid and has been given enough naloxone, regardless of the brand, to reverse an overdose. It's going to happen almost no matter what. Some doctors would say it's like roughly 90 something percent of the time. And I would be happy to find the research and articulate that for you guys. But because of that, when we are questioning about precipitated withdrawal and wanting to avoid that, we need to be careful that we're not saying, okay, so the alternative option is then we accept death because we want to avoid precipitated withdrawal. As someone who just this past February lost her cousin and to a fentanyl overdose, I would have preferred for her to be in precipitated withdrawal for a period of time and then still be alive than for her to be dead. And I think if anyone on this call has lost a loved one, they would probably feel somewhat similar. And again, the nuances between using high dose or low dose or regular dose naloxone, regardless of the brand, we are not medical professionals. So we can't expect ourselves to be able to respond with that critical medical insights. We can only respond with the best options we have at our hands, and all tools should be available. If you don't feel comfortable providing a high dose naloxone and you're lucky enough to have enough supply of 4 milligram or enough supply of a 2 milligram dose naloxone, then you can provide the smallest dose possible to try to titrate these individuals back to life. But it is of our prerogative that if you need 2 doses of naloxone and you have Narcan, in that case, you may only need the 1 dose of Kloxxado, right? Because it is milligram for milligram, it is the same concentration, is just 4 versus 8. Now there are different brands that are coming out, like Opvi, which is still new to the market, and I'm still learning about myself, that's actually using an entirely different compound called nalphamine. That is something I hope to be able to educate people in this group on in the future. But when we're talking about, in particular, Narcan or Kloxxado, they are both naloxone, HCl, they are just different concentrations per dose. And it's really just about increasing awareness, right? And I hope to be able to do that in the coming months. We're not against Narcan. I'm not against Narcan at all. Narcan revived my cousin from an overdose once in the past. And so all tools are necessary. And to address another question is, once an organization is part of the Florida Naloxone Network, what is the process to engage them with the overdose prevention program? Well, for those who are not already part of DCF's overdose prevention program, we hope to be able to bring awareness to them on what the steps are that they need to be taking to become a distributor of naloxone, provide them with that paperwork, help guide them through finding partnering pharmacies to be able to receive that naloxone, getting a standing order so that they can get any form of naloxone that's not going to be available over the counter, and then connect them with the necessary people within DCF to be able to enroll them. DCF will then take over, and then we will be here to be able to provide best practice guidances, share that, or partner to provide distribution. And like I mentioned earlier, we hope to be able to provide that initial supply if we have the flexibility to. We definitely hope to be able to provide that initial supply while organizations are getting enrolled so that they can distribute naloxone right away. And I can't say this enough, we are not one for the other when it comes to harm reduction tools. I hope to be able to bring representatives on to educate us on drug testing kits and fentanyl testing kits, xylazine testing kits, and hopefully education on things like doTERRA, which is a chemical neutralizer so that you can safely dispose drugs. I want to be able to highlight all harm reduction options, from the most nuanced to the least nuanced. So thank you everyone for joining us. One more opportunity here if you weren't able to scan and join the network just yet. If you are interested in becoming part of this network, please consider joining it. We want to share information. We want to share studies. I know studies have been mentioned in this chat. We are constantly looking at them and want to be able to increase that awareness and share that information with one another. And so thank you guys so much for joining. We are 3 minutes short. I want to say thank you to Steve from my team for coming on and helping us talk about that data and the landscape of the crisis in Florida. And again, thank you, Lindsay from HICMA, for coming on and talking to us a little bit today about Kloxxado. In the spirit of collaboration, I hope to be able to partner and lift your voices in the audience and be able to talk to you guys in the future so that we can work together and save lives, because that's the goal. Thank you so much, everybody. I will let you go 2 minutes early onto your day, and have a great afternoon. Thank you all. Take a second. The chat will stay open so that you can get those contacts. Hopefully everybody has been putting their contact information in the chat. We will also be sending out a follow-up email with a recording of this information session, a copy of the chat, and the Q&A. Thank you guys again, and have a great rest of your week and weekend.